True Story is a documentary podcast powered by the Institute of Documentary Film. You can find news from the world of film on all the common platforms such as iTunes, Google Podcasts, or Spotify, as well as on docweb.net.
Good evening, ladies and gentlemen. My name is Ivana Formanova, and I'm the manager of KineDok, which is one of the activities of Institute of Documentary Film. I hope you are staying safe and well in these difficult times, and that you have chosen tonight to connect with us to this panel, which will be about the topic of mental health. KineDok is a community-driven alternative distribution that organizes community screenings at alternative venues across 6 countries. And this discussion tonight will follow on the topic of a documentary film Solo, which you had the chance to see in the past 2 weeks. Artemio Benki's documentary Solo premiered at Cannes in the section called ICIT in 2019. And it also won in the same year at Jihlava International Documentary Film Festival based in Czech Republic. The author and French director, who has been living and working in Prague for a long time, captured the story of Martin Perino, who is a young Argentinian mentally ill piano virtuoso who has spent some time in a hospital in Argentina. Tonight, we are together with the international partners of KineDok having a discussion with invited guests. We have Jana Muranska, who is a director of NGO RATA based in Slovakia. She's also a therapist, and she's a pedagogist teacher. She's doing counseling and education. And then we have Dajana Miloš from Croatia. She's a psychologist and a music therapist working with Zdraví grad, Healthy City organization, which is a project that has been operating in Poreč and for almost 30 years. And the basis of this project is innovative action in promoting community health. She's also working for an organization for music therapy called HUM. Thank you, ladies, for being here. I'm very much looking forward to this discussion. And I forgot to add one last thing for our viewers, that if you have any questions throughout the session, you can ask them in the comment section below, and I will communicate them to our panelists. I would like to give a word first to Jana, maybe if she would like to add something to the brief introduction. Thank you for being here.
Good evening. Thank you for inviting me. I think you have managed to to introduce me quite well. I come from Slovakia, where I also work in Bratislava in a small NGO. We work with kids with developmental disorders, mainly autism. And we do not directly work with clients with mental illness, but I think that these areas are very closely interconnected. So I hope I can add something interesting to our discussion tonight. We are a rather small NGO, but we act locally, and we have many international projects aiming at promoting awareness about the most common developmental disorders in childhood, and promoting educational opportunities and access to early therapeutic treatment for the children, as well as support for the parents and online and in-person education, if it is possible, to parents in how to work with their kids in order to develop them as much as possible.
Thank you so much for what you're doing. This is very important. I would like to give the word now to Dajana Miloš, if you would like to tell us about your organization that you work at.
Ivana, thank you very much for inviting me to join this discussion tonight. and greetings from Croatia. So my name is Dajana, and I'm a psychologist and music therapist. I'm employed as a counseling psychologist at the Center for Providing Services in the Community, the Healthy City of Poreču, in the Istria County. And this is a counseling center that is part of the Healthy Cities Network, a project of the World Health Organization. So it's also a non-profit organization, city founded from the city of Poreču, and the main goal of this organization is physical, environmental, mental health care, and the implementation of academic knowledge and local interventions for health into the life of the community, so the citizen. And we design and implement different health programs, and also have a counseling center for children, adults, families, and we work with different kinds of mental health problems and addictions. So additionally, I also worked on several projects with children with developmental disabilities and with the elderly population. And also I worked for a year in a psychiatric clinic in Osijek. So I have experience with the psychiatric population, and I'm familiar with the structure of mental health institutions. Also have experience working in contact with people with severe mental illnesses such as schizophrenia. So I'm a little bit familiar with the theme of this film, and I hope I will be able to answer your question. And yes,
definitely, I have no doubt. Thank you also for what you're doing. That's incredibly important work. And I will ask with the first question for both of you. Maybe Jana, you can start. What did you think of the film? How accurately do you think that the struggle of going back, struggle of the illness and then going back to normal life is portrayed in the film?
Yeah, thank you for sharing the film with us. I didn't know about the film before I received the link, and to be honest, I had to watch it twice in order to capture everything. And I think it is very well and sensitively made, and I think the main character actually did a very great job by coming out with his very intimate confession about how he was actually dealing with the issues that are associated with being diagnosed with a mental illness. Because it's not only the acceptance of the diagnosis itself, it's also, I would say, that the very difficult acceptance of the need for the treatment, and then being hospitalized for so many years also means to being cut off from some very intense relationships, and then going back to your normal life again. It must be a very, very difficult struggle. And I think the film portrayed it very realistically. But I think Dajana might say whether it's true, better from her perspective, as she has the experience with clients with mental illnesses.
Yeah, thank you. Dajana?
Yes, I think the film is very well made. I have to admit that at first the whole way it was shot seemed a bit awkward. Like we have that camera shaking at the beginning and a series of unrelated actions from different time periods. But just such a way of filming gives us an insight into the fragmentation of the mind of the main character. So Martin Perino, who suffers from this severe mental illness, he has schizophrenia, and otherwise schizophrenia is by definition a split of the mind. So it is a mental disorder characterized by continuous relapsing episodes of psychosis, with also hallucinations, delusions, paranoia, and disorganized thinking. So this film actually shows us more this other type of symptoms, like this emotional difficulties in expressing emotions, and these difficulties in the social relationships. The apathic, Martin was apathic in some periods, and also may act like disinterested because he was in his own world and experienced the world around very differently from others. So I think it's the emphasis is on these difficulties in his social functioning, and so it was also very difficult for him to return into the normal life after the hospitalization. Mm-hmm. And we saw this period of his returning to normal everyday life. In the film, it is well illustrated. This is something we called resocialization, returning to everyday life, finding a job, recontacting with people outside the institution. So we saw Martin returning to his home where he used to live before. This place was very different from how he remembered. There were little furniture, only a few personal things. He didn't even have a piano there. And so all this was very stressful for him. And the main goal is actually for these patients, for the resocialization, to facilitate this transition for the patient as much as possible. So we see in the film also a lot of therapeutic intervention that prepared actually Martin for going back to everyday life. Martin was prepared to return to his life. He spoke on several occasions about his fear, about the outside world. We saw a great drama therapeutic intervention when he talked to puppets. I think that these interventions actually, especially when it comes to creative types of therapy, are beautifully portrayed in the film. And we saw also after Martin left the institution, a therapist came to visit him for some time, and he socialized with people who were also patients in the psychiatry unit. And after leaving, he continued to socialize with the dancer who introduced him to some social events. So this could be a way for making this transition.
Mm-hmm. Mm-hmm. So do you think that the use of music in the case of Martin Perino can be considered music therapy? And can you maybe tell us a little bit about what music therapy is and how exactly does it work, Dajana?
Mm-hmm. So actually music therapy is a therapeutic approach that uses music or musical interventions as a means of communication and expression. And in music therapy, we use music to achieve non-musical goals. So not to teach music actually, and in different developmental areas such as cognitive, social and emotional development, speech and language development, even fine and gross motor skills development. And when we talk about adults, we can use music therapy as an intervention to improve functioning in certain areas, or for example, develop new skills, reduce some symptoms, or as a way of rehabilitation. And within the area of serious mental disorders, the aim of music therapy could be to help people improve their emotional and relational competencies, address issues they may not be able to using words alone. So music can be an additional way to express themselves. We see in the film that his music, actually Martin's music, which probably triggered the onset of the disease, was also the way he established contact with others. It was the way that Martin actually communicated with others, with his environment. At certain moments we can saw that the music he created was certainly therapeutic for him. Although I wouldn't talk about music therapy in the true sense, because we haven't seen an expert perform it. So Martin was himself the music therapist, mm-hmm. and you can perform it on your own. Mm-hmm. Also, music therapy is a planned intervention with certain goals, and Martin's playing was actually more in terms of compulsion. If it calmed him down, but he didn't clearly realize what he wanted to achieve with it. So at times it was his way of communicating, and we saw how the environment reacted well to it. Like one of the patient was then danced, and the other was painting through the music, and it was still very interesting for me to see certain interventions. Even Martin himself was actually some kind of music therapist to the other patient when he was together with the patient on the piano, and when he accompanied him while he was improvising on one tone and wanted to play Michael Jackson or something like that. And Martin had the role of an accompanist, and we could actually say that he unknowingly used some music therapy techniques like, for example, mirroring, grounding, accompanying, but he wasn't actually a music therapist.
Mm-hmm. Okay, thank you so much. So in the film, we see a protagonist who has mental health problems, and mental health problems are often associated with stigma, and people with mental illness have to deal not only with their impaired health, but also with stigmatizing attitudes, negative stereotypes. And both of you have long-term experience with people diagnosed with mental illnesses or mental disorders. How would you characterize stigma and the consequences in the society, and how can the people who are stigmatized fight it? And what can we as individuals and also the society do to maybe try to prevent it? I would ask Jana first.
Yeah, well, stigma is a negative attitude, a sort of prejudice that we have towards someone or someone's condition or someone's attribute. And it is actually true that also in our society, we're in Slovakia, we're a Central European country, this stigma towards psychiatric patients prevails a lot. But there's also stigma or negative attitude towards psychiatry as such, I would say, that it is very difficult for example, we have to advise parents of a very young children to see the pedopsychiatrist. And it's very difficult for them to accept the fact that a pedopsychiatrist is someone who can help them and help their child to actually do better. So there's a lot to do when it comes to this among the general society, where we can build up more awareness and more education in the field of understanding the conditions of the psychiatric conditions that people may suffer from. Especially people working in creative areas are very vulnerable. But I would say nowadays, with all the things happening on during the past 2 years, it's very likely that the number of people needing help or being exposed to probably some psychiatric, how do I say that? How do I express that? Psychiatric problems or issues will increase. Mm-hmm. And a very common comorbidities, for example, of developmental disorders in kids that I work with are anxiety and depression. So also children and young people are very fragile when it comes to mental health issues. So we should educate ourselves, educate others, spread the awareness, and also get rid of the stigmatizing of psychiatry as a discipline. And us as people from non-profit organizations, I think we can do a lot locally, but also on higher levels, because we can create a sort of bridge between the professionals from the medical sphere and non-professional environment, and create an atmosphere of trust and maybe of more sort of
understanding.
Yes. Thank you.
Mm-hmm. Definitely. Thank you so much. Dajana, would you like to answer this?
Yeah, I agree with Jana about the stigmatization of psychiatry in general, because also we see in our counseling center that more and more people are coming with different difficulties like depression and anxiety due to this situation in the world. And I also a lot of time I tell them to go to visit a psychiatric too, because it's not always they need also some medications, and I cannot provide them with medication. But why we actually stigmatize? So I think people stigmatize things that are unknown to them, and such things scare them. We know very little about most psychiatric diagnoses. Often the behavior of psychiatric patients and of psychiatric illnesses is unpredictable. And because maybe of this fear of the unknown and ignorance, how to treat, like we have a lot of questions like how to treat them. What are we allowed to say with these people? What are we not allowed to say or to do? Mm-hmm. It leads us to starting to avoid them and not to talking about their illness in public, precisely because it is frightening and embarrassing for us in general. And while working in a psychiatric hospital on the world, I had one mixed group of patients. Mm-hmm. With different diagnoses like addictions, depression, PTSD. And with them, I did psychoeducational groups and also music therapy. And during several sessions, we talked about how they feel when they have to explain to others what they are dealing with. They complained that they often feel rejected by their environment, that the environment does not understand and often does not want to give them a chance to prove themselves, especially when it comes to, for example, employment of people with a psychiatric history. And we have come to the point that the environment is afraid of them and therefore avoids them. And then I suggest that we dissuade the environment to prove that they are not dangerous for them. And so we wrote a song called Antistigma Song, whose main message was that their disease would not harm anyone and that it was not transmissible. And they sang about how they feel and what they need. So we see that through music therapy, we can also do actually something with this stigma. So one part of destigmatization can certainly be done through educating the public, so that we introduce them to psychiatric diagnosis, introduce them to how to treat people who have some mental health problems, because we have more and more people struggling with dealing with these kind of problems. And on the other part, to bring the psychiatric population closer to them. One example was that concert in the film that they had in the beginning of the film, when patients presented themselves through the various creative activities, singing, dancing, playing instruments. And then if we involve the public, the community in such events, then we are talking about a music therapy model called community music therapy, where the community is part of the music therapy process, and which can greatly help in destigmatization and what we said before, resocialization of psychiatric patients. So because this way they can make connections with people from outside, from the community.
Yeah, I'd like to add that also this documentary was actually one of the very important tools for destigmatization, because it was a personal confession. And if you have the first-hand confession or explanation or picture of the psychiatric condition, then it really makes you understand a lot more than the texts and the flyers and things like this. Yeah,
I agree, definitely. I would like to now read a quote from Martin Perino from an interview with the protagonist, which was conducted in 2019, right after the premiere of the film. He says, even when I was young and in school, I was sent to a psychologist because I had some behavioral problems. At the time, it was probably due to the problems in my family, which I couldn't cope with. I wanted to follow up on this and ask Jana, because she's the director of RATA, who is focusing on finding the diagnosis at early stages. So I wanted to ask you, how soon are we able to find out if the child is suffering from a mental disorder, and if there is any institutional process that can help us with finding help if we think that we do?
It's a very complex question, and I'm afraid I can't answer everything, but I'd like to say that it actually takes a long time to get the diagnosis, official diagnosis. It's not as if you come to doctor with a symptom of flu and then it's a very obvious that this is flu because you have running nose and you have sore throat. This is something that's not visible and not based on some biological markers. So there's no blood test or anything like this that would prove a child has the symptoms of developmental disorder, but it can be only spotted via the observation of behavior. So it has to be carried out very carefully and in a longer process and by more people, so that the diagnosis is very objective. And we mainly work with children with autism spectrum disorder. So people whose children behave differently in the very early age of like 1 year, 1.5 or 2 years, the reactions in a play, in a mutual communication, and so on with the child. And if we see some symptoms, usually these are the symptoms of not shared attention with others. A child prefers to be by himself or herself, indulge in the activities that are self-stimulating, not cooperative activities or socializing activities, but self-stimulating activities. The play is developing not with the function of a play, but by the stimulation it provides for the child, either sensory stimulation. Child likes to look at something that spins, for example, or likes to do some movements that produce certain sound, or likes to put things in certain order and looks at it from different angles for hours. So this is something that you can spot as something very atypical of a small child. And one of the biggest symptoms evident is the lack of the speech development. So it's a very big delay in how the speech is developed, but not only speech as an expressive part of the speech, like the ability of a child to say words, but also the understanding of it. So a parent says something and the child does not react, like come here, and the child does not react, or you call the name of a child and the child does not turn around, and so on. So these are the things that really are completely important for our life in a society and our further education and progress in the development. Because without paying attention to others, without understanding language, and without being able to imitate what others are doing, we cannot really learn further skills. So that's why the therapists have to step in, and we have to, I usually say when I explain it to parents, we have to teach your child all these things, but artificially. We cannot wait until the child soaks it in from the environment, but we have to help the child to find or to acquire the tools to do it with our help artificially. This refers to language, to imitation, to paying attention to what others are doing and repeating it, self-service skills, everything. And it's possible. And we've seen many success stories of kids that are able to study, to find a job, to live on their own. Because, for example, autism is a very broad spectrum with very varied manifestation of the symptoms. So you can't find two people alike. So it's really it really differs. There are stories of people who will never be verbal, will never be able to communicate verbally, for example, but that does not mean they cannot communicate at all. We have to find alternative solutions for them, alternative ways of communication, and they can learn. I think nowadays we are so far with the science and with the special education methods and various therapeutic tools that we can really develop skills of people that are not developed naturally during their development, but we can help them achieve so much. We just need people who would like to work in these professions and are there for them.
So when a parent discovers one of the symptoms while observing their child, so what are the next steps? What they can do? Can they do something to try to help them with the development? Some techniques, or do they need to seek help?
Yes, they need to seek professional help. The ideal scenario would be to see the pediatrician and consult the pediatrician. But in our countries, still there are many pediatricians who are not paying that much attention to a delayed development. For example, a child is not speaking. Oh, don't worry, your mother started speaking at the age of 3 or 4. It will move on. But we shouldn't really consider these symptoms as something marginal. We should address them. So if the pediatrician cannot refer you to other specialists, then you should seek help yourselves. There are many NGOs in the field, but in the state sector, there are counseling centers. In our country, there are early intervention centers, which are here for it's a social service in Slovakia. In some other countries, it might be under health departments, and children with divergent development ages 0 to 7 can actually get counseling there. Their families can get counseling there, get some initial screenings, and then they can refer them to further therapies and other services that would help child to develop. The official diagnosis, however, is given after the age of 3. So the first diagnoses are suspicions for something, or they are very general, like delayed development in general, delayed speech development, and so on. So after the age of 3, in Slovakia, for example, a psychiatrist can then give more specialized diagnosis. But still, a child goes for a reassessment before entering elementary school at the age of 6. And we've seen many kids who have moved within the spectrum of diagnosis. It really is very individual.
I have one last question for you, Jana, about people who are diagnosed with ADHD. Is that a phenomenon that is occurring in the modern society, or why do you think that this illness is now so, or not illness, disorder is now so common?
It has to do, everything has to do also with the ways we live and the ways we are brought up in our culture. And of course, in the last years, the ways of bringing kids up is a bit different than it was 20 years ago or 40 years ago when we were brought up. We spent a lot more time doing very ordinary things, and we had a lot less how do I say that, sensory stimulation. Yeah. So nowadays really the world is full of sensory inputs, and you can hear sounds and you can see everything changing constantly. There are so many devices that kids use from the very early age. There are so many comfortable helpers for mothers to take care of their kids. So kids are not moving at all in the first years of their life. Also, this contributes to their development lagging behind, and some symptoms showing impaired attention and difficulties with focusing on one thing. But at the same time, it's necessary to say that there's not one cause for a disorder. There are always several factors involved. So there's a genetic predisposition that plays its role. There are environmental factors, of course, but there are so many things that we can do to help these kids that I think to live with ADHD today, it's possible to live really fully, and these children are, apart from being really difficult to manage in the classroom, they are so creative and they have so much potential in so many areas that we shouldn't think of them as of something really problematic through the stigma, but through their abilities. And that's, I think, true about all of the people that we are talking about today, that all of them have their unique abilities. And this sort of attitude or vision or view of them prevailed, then it would be a lot better.
Okay, thank you so much. I would like to read a quote from the interview with the protagonist. Later, he said, later I sought out addictive substances to help me cope with some difficult situations and to help me deal with things around work. In my case, playing the piano and composing, says Perino, who says drugs were a significant factor in the onset of schizophrenia disorder. So I wanted to ask Dajana if you can maybe tell us a little bit about schizophrenia and its onset, if this is something maybe common, or if schizophrenia can be also genetical and can just appear, or what are the factors that stimulate you to find out that you have this illness?
So I cannot say that schizophrenia is genetically, but we have definitely a genetical predisposition for this illness. And as I told earlier, schizophrenia is like an illness, very severe mental illness that actually it's like a split of the mind. So it has different symptoms, like cognitive symptoms, positive and negative symptoms. The positive symptoms are not positive in this way, like they are positive, but they're positive as they have like hallucinations and delusional thinking. And we also have this other symptoms that goes in comorbidity with schizophrenia, like depression, anxiety, often drug addiction, and other problems. And often we diagnose schizophrenia in the early adulthood, at the age of 20 or something like that. I think it's an illness that is chronic, so we don't have actually a drug or a medication that can help with this illness, like cannot heal the illness, but we can help with the symptoms of this illness. Like I said, delusional thinking, hallucinations, there are different medications and different types of drugs, like, I don't know, for depression, for the depressive symptoms, for anxiety, for the hallucination, and also psychotherapy and other types of creative therapies or work therapies can also help these people.
Mm-hmm. And if I go back to music therapy that we were talking about earlier, is music therapy suitable for all kinds of illnesses and disorders? Is it applicable while trying to treat them, or?
Yes, music therapy is applicable to all different types of illnesses and also to all different types of people, independently of their musical background. So we don't need to have a musical background to play actually an instrument or to sing good to be part of music therapy session. And we have also different types of music therapy, so we can arrange maybe the music therapy session to the different types of symptoms and of illnesses, and also different type of goals that we want to achieve. We have also receptive and active methods of music therapy. Receptive methods are this means that the client is involved in musical experiences through listening, or for example, music imagery, a type of guided relaxation with music, or analysis of the text of music, or music reminiscence, and so on. And the other type is active music therapy, used mostly with children with special needs, as Jana told earlier, with autism, ADHD, and other, but also with adults, for example, with schizophrenia. And this type, the active music therapy, means that the client is actively involved in making music with the therapist or in one group of other clients and therapists. And that implies active music therapy methods like songwriting, for example, composing, playing instruments, music improvisation, that sing-along, performing, and other methods. And according to different research, music therapy as a complementary therapy or an addition to standard care or standard therapy, like pharmacotherapy and psychotherapy, can improve the global state and the mental state of people with mental illnesses, such as schizophrenia. Music therapy can also improve the quality of their life and help them with the social functioning. And it is also an effective method for treating depression, anxiety, and other types of mental illnesses and mental health problems.
Mm-hmm. And you also mentioned addictions. So is music therapy also used in terms of fighting addictions, for example?
Yes. We can do a lot of psychoeducation through music. Like we can sing, as I earlier told, we can sing or make a song about, for example, stigma, or we can sing about medications. Why should we use medication? Like in schizophrenia, they need to use medication, and they're mostly not motivated to use their medication. So we, through song, we can talk about this, why it is important. Or we can work in groups, and it's very important to have a group that actually sustain us as a person that have trouble and struggling with these mental health problems. So we can work in groups, and we can help through music people connect to each other, and this is very important for in different mental illnesses, also in addiction, to have some friends, to have somebody that I can rely on, and I can actually have a social connection with somebody.
Mm-hmm. If I'm not mistaken, music therapy is quite a young field. I wanted to ask you, what are music therapy perspectives in terms of the development in clinical practice?
Mm-hmm.
You can maybe tell us a little bit about that.
In Croatia, it is still conducted at the level of different associations and private practices, and has not yet entered as a standard method within the health or social care system, in the sense that you still cannot get music therapy on referral.
Mm-hmm.
And although some institutions provide different forms of music therapy, mostly as part of occupational therapy, but these methods are still not performed by certified music therapists. Mm-hmm. Because there are still a few of them in Croatia, and our interest at a specialist level is not fully recognized. So this study is very young in Croatia, 3 or 4 years. That is actually the specialistic study opened in Osijek. So there are still few music therapists in Croatia. And so there are some goals to work on popularizing this discipline, and also to implement music therapy in the system as also other creative type of therapies.
Mm-hmm. Okay, thank you. I wanted to ask you, both of you, since it has been already mentioned tonight and in this discussion, that over the past 2 years, people have had much more to cope with than before. So
that's also because some services were unable to work in person for a certain period of time. The waiting lists to get the diagnosis or consultation when it comes to, for example, diagnosing autism are as long as 18 or 19 months, mm-hmm. which is nearly 2 years. So it's super long. And of course, you need to help the child really at this moment. So we receive about 6 to 10 emails per week. And we are a very, very small center with 8 people working there. So it's impossible to keep track with this speed. And I think people feel pretty much isolated. And we can see it also on older children, lacking that social contact with the peers. But also small kids who should be socialized in kindergarten and at the playgrounds and growing up with other people, they grow up in isolation. And many of them, since we live in Bratislava, there's not many families who live in a house with a huge garden. Many of them spent nearly a year closed in a flat, a small flat, with limited options to move around and so on. So it's really, I think we will have an increase in seeing more kids with developmental disorders, and also parents are a very vulnerable group in that respect, because they feel isolated with their problems and they think that it's only them who are not handling the situation. Perhaps not having the appropriate parenting skills and so on, and they are actually at risk of developing depression and so on. So we are trying to form support groups for parents as well, to give them some sort of platform or space to talk to each other, to exchange their ideas, but it has to be guided, of course, by a therapist. to get them the feeling, to enable them to feel that they are not alone in their situation. And for us therapists, I think we are right now preparing some projects for the burnout prevention, because the workload is big, and we have to have the source of the energy in order to provide these services for others. And this is very important, I think, in helping professions to create like sustainable space for people working in these professions to get the energy and have time for themselves and develop soft skills and other things in order to keep at full power to help others. So yeah.
Thank you so much. Dajana?
Yes, in our center too, the number of people seeking help are increasing. So we see a lot of children and adolescents with problems, and more children struggling with mostly anxiety, because this situation is very uncertain. And we have like 1 week school in school, and 1 week online, and then again 1 week they're going to school, then maybe they're in self-isolation, or they have COVID-19, and so this is very confusing for children and for adolescents, and they need this social contact with other children, and this is very confusing for them. So we have a lot of children actually, and adolescent, more and more children with anxiety and problems in the field of anxiety, like social anxiety, school anxiety, and also the parents that don't know how to respond to these needs of their children. So more and more people are actually need help, and we are only 6 psychologists in this center, so we are actually covering a very big area of the northern Istria County, and we are, I think, just one of the institution of this type in Croatia, maybe. So
Okay, thank you so much. So our time is almost up, so I would like to use this last couple of minutes if you have some recommendations or tips for people who are currently struggling with mental health issues. And if it has already been said, maybe just summarize it, just some few tips so that people know that they are not alone, and that it is completely normal in quotes and quotation marks, that people are struggling as well, and that they are not alone. Jana, maybe you can start.
Yeah, I would say in general, I'd say that we should pay attention to the others, and to be sensitive to others and their perhaps what's behind their behavior and what's behind their reactions, because there might be really difficult reasons for that they struggle with. And for those who struggle with the problem already, it's difficult to give like a very simple advice, but the only simple one would be try to seek help, and don't worry to talk to someone who can listen, be it a friend or a sibling or whoever, because it releases a lot of tension and helps you to find the solution. Like the worst thing is to have everything hidden within yourself, and to isolate yourself from others. So try to find someone you can talk to, and you'll find further solutions.
Perfect. Thank you so much. And Dajana?
Yeah, I would recommend everyone to use music, because Why not? Music can be used like a way for calming down, a way for a distraction, and you can use the music that you like. It's not one kind of music that can help you. A different kind of music can helps us in different situations. And also music is a very good, I think, medium that helps us release our feelings, our difficulties, whatever they are. Maybe also good feelings, but also very bad feelings or very uncomfortable feelings like depression, anxiety, or fear. And we can even release unpleasant thoughts through music. We can even communicate with somebody through music. And if someone is playing an instrument or singing, maybe it can be also a great way to distract. But also like to trigger maybe the experiences and emotions we are dealing with. And it is also good to be informed, but I think it's also important sometimes to move away from all this information and from all the things that do not benefit us at the moment, and that we cannot influence on. Like we now are seeing a lot of videos from the war, and earlier a lot of numbers from corona deaths and different type of information. So maybe sometimes it's good just to move away from this, because we cannot actually influence all of this, and we can just be like very bad with this information, and we can feel anxiety and fear about this. So be kind to yourself, because these are very difficult times we are going through, and I hope that all this will pass quickly, and that it will not leave too deep wounds on us.
Thank you so much for these beautiful words for the ending of this session. Thank you so much for our guests, for the participation, and also for what you do for a lot of people who are needing the help. I would like to also say thank you to the visitors, to the viewers who have been with us until now. I would like to also tell you to stay tuned, because we are having a catalog of new films, KineDok 2022, announced soon. It will be across 6 participating countries: Czechia, Slovakia, Hungary, Croatia, Romania, and a new participating country is Georgia. So in all those countries, you will be able to watch our films live with accompanying program in the form of panel discussions. Sometimes we will also have online discussions, and we will also try to do some educational screenings in schools and libraries. So I would like to thank you for following us if you already do, and if you don't, just keep the eye on our program on the social networks or on our website. So thank you everyone again, and have a good night.
Thank you.
Thank you very much. Stay safe.
Yeah, bye.